Hello, my name is Jack Topkoff, and today we're going to talk about the A&P of the spinal cord, and a little later on we'll talk about Kennedy's disease. To start, the spine is composed of more than just the bones. The spinal or vertebral column surround and protect the spinal cord as well as the spinal nerves. It's composed of 26 or 33 bones referred to from top to bottom as 7 cervical, 12 thoracic, 5 lumbar, 5 fused sacral, and 4 fused coccyx vertebrae. Stacked onto each other, they form an arch cushioned by cartilage and collagen fibers and water called intervertebral discs. You have 23 of them. Housed within each vertebrae lies the spinal cord, along with the gray matter and the white matter. The most central is the gray matter, and it kind of resembles an H and is subdivided into posterior, anterolateral, and anterior horns. Additionally, connecting each side is some more gray matter called the gray commissure, and it's composed of unmyelinated axons for purposes of communications between the left and right sides. External to the gray matter is the white matter, which is also subdivided into posterior, lateral, and anterior funiculi. Similar to the brain, the spinal cord is also protected by pia mater, arachnoid mater, and dura mater, but just external to the dura is the epidural space composed of adipose and areolar connective tissue. Spinal nerves, they exit the spinal cord and send and receive signals from muscles, skin, and other organs, seen right there. There are two main parts of each spinal nerve: the anterior rootlets, anterior root, anterior rootlets, anterior root, and anterior horn. Those house the somatic motor neurons, where the posterior rootlets, root, and posterior horn actually house the somatic and visceral sensory neurons. The anterior horn or anterior portion control all of our voluntary movements, such as our skeletal muscle, whereas the posterior portions control somatic sensory, such as tactile receptors like the skin, or on the skin, and the visceral sensory neurons are for sensory of the internal organs. Lastly, the lateral horn, out here or out here, the lateral horn, kind of on the side, houses the autonomic motor neurons, which control involuntary responses such as your cardiac or smooth muscles or your glands. The white matter is previously discussed, composed of the funiculi, or funiculus for plural, which use conduction pathways, and they utilize tracks to relay signals between the brain and a specific part of the body. We have sensory and motor pathways. Each spinal nerve exits and almost immediately splits off into two branches. So after here, splits off into posterior ramus, which innervates the deep muscles of the back, and the anterior ramus, which actually split off into many other small branches, which innervate things such as the skin, skeletal muscles of the anterior and lateral trunk, as well as the upper and lower limbs. To finish up real quick, we're going to look at a spinal cord disease called spinal and bulbar muscular atrophy, or also known as Kennedy's disease. It's a lower motor neuron disease which may look like ALS, but is progressively slower and also only involves the lower motor neuron. It's linked with a gene on the X chromosome and recessively passed from the mother, and it mainly affects or primarily affects men, but in some extreme cases it does affect women. Some of the symptoms include muscle weakness, muscle atrophy, gyno, enlargement of the breast tissue in males, impotence, and testicular shrinkage. Like ALS, symptoms also can include muscle spasms and tremors. And lastly, if it's seen in the bulbar muscles or the neck muscles, symptoms can also include difficulties in swallowing as well as speech. Unfortunately, like ALS, there's no known cure for Kennedy's disease, just therapy and rehabilitation to further slow progression. And that concludes the AMP of the spinal cord. Until next time, peace.